On this episode of the CBD University podcast, Novel Foods and the CBD industry, what it all means and how our products could be coming to more countries and consumers around the world in the months ahead. The latest step to how we are doing CBD right every day. This is the CBD University podcast and it starts right now. I'm Joe Augustinelli, host of the CBD University podcast. And if you are a first-time listener, we are glad you found our podcast on your platform of choice. And if you are a returning listener, welcome back to our podcast. And for those of you who like to watch video episodes of podcasts, if you have not yet done so, check out our YouTube page, the Global Widget YouTube channel, and the YouTube channels of our brands Hemp Bombs and Nature Script for full video episodes of the CBD University podcast. And this is another one of our Zoom episodes. We are joined via remote, and I'll introduce everybody in just a minute. But as the CBD industry continues to evolve both here in the United States and around the world, we are going international on this episode as we discuss novel foods, what it all means, how the novel food status affects CBD, and what it means for our products getting into the hands of consumers outside the U.S. So we're talking the United Kingdom specifically today. Joining me for this episode is our Chief Compliance and Legal Officer, Margaret Richardson, who's been on the podcast quite a few times before. Hello, Margaret. First time, I think, ever remote, though.
That's true, Joe. Lots of fun.
And then Greer Deal is the Director of Global Regulatory Services. Welcome, Greer.
Thank you very much, Joe.
And Dr. Rafe Bundy is an Associate Consultant at Global Regulatory Services. Welcome, Dr. Bundy.
Hi, Joe. Nice to meet you.
So let's first start off with Greer, and for our listeners who are not familiar with it, what are novel foods and how does it pertain specifically to the CBD industry?
It's a very, very good question because everybody thinks food is just food. And no, we have a regulation for food that is novel, and novel means that there's no significant consumption of that food or food ingredient in Europe before the 15th of May, 1997. Not quite sure why there's such an exact date, but there is, according to our regulations. So with respect to CBD, though, I think a lot of people are aware that it is available on the global market as a food, as an ingestible, and specifically with Europe and the UK, it is already on the market. But the novel food regulation, you're actually supposed to apply for approval to convince everyone and demonstrate that the food is safe to consume before you place that product on the market. But we have CBD products already on the market. So we're in this very unusual situation. There's a grey market because strictly speaking, these products are not supposed to be there. They're illegal because they haven't been approved. They haven't gone through this full validation safety assessment process. So, but it's a huge, and excuse the pun, but it is a growing industry and it's great for economies. It's great for the health of people as well. So governments don't want to pull product from the market. So we're having to do things retrospectively. So, and when I say retrospectively, CBD was only announced as being novel in January 2019. So it's all relatively recent. And then just to give you a little bit of history, then last year, summer 2020, the EU Commission suddenly sat back and thought, oh, actually, is CBD a narcotic and not a novel food after all? So the applications which had gone in for approval were all paused, and it took a few months before the EU Commission, having consulted other bodies, etc., and there were a few other legal cases going on as well, they actually came back to the industry and said, no, CBD is novel, so carry on.
Mm-hmm. And Margaret, we've talked in past episodes about our commitment to safety, quality, and compliance. How is this another step in the process of not only doing CBD right every day, but continuing to lead the industry in compliance?
Yeah, well, I think, and Rafe can probably talk to this a little bit more, but in order to complete the application, we also had to do a number of different safety studies. And I think, that again provides some comfort to our consumers that CBD is safe and that there aren't any issues with it in terms of ingesting it in reasonable amounts. Of course, the UK has put a limit in terms of the potency, the milligrams that you can take on a daily basis. So, the products that we're looking at are, within that band of safety that the UK has set up.
And how long, how page-wise, how long is the document that has to get submitted?
Very big, right, Rafe? If you print it all out with the appendix, it's approaching 400 or 500 pages. So I mean, from a regulatory perspective, that's pretty common.
Yeah.
When you submit applications to regulatory agencies, because you've got to include all of the data and backup data and appendix and all types of exhibits. But yeah, I mean, it shows that there was definitely a lot of work that went into it. A lot of other activities that went to support that product, whether it was getting data from the very first where the hemp came from, showing and proving that you grew it properly, and then of course all the way to the isolate and then how we manufactured and produced product that we later used in a clinical trial. So it's a lot of detail that goes into that agency for review.
And Dr. Bundy, talk a little bit about the science. Margaret alluded to some of that on the different studies that have been a part of from a scientific angle. What are all these studies about, and how are they conducted, and what are the objectives?
Well, I guess the overall objective really is to prove safety. So really, that's what the regulators, that's the bottom line for them. Is the product safe? Is the CBD safe? So I won't kind of go into all the technicalities of the studies, but you basically have studies to look at what they call genotoxicology, which is like, does it affect the gene level, the DNA, in us? Mm-hmm. Does it affect our organs? And there's kind of studies that are done in a test tube, in vitro. Sometimes, unfortunately, studies have to be done more in vivo, and potentially animal studies. Is kind of the same thing that you would do if you were testing a drug, if the FDA were testing a drug for the market. And it's really just to kind of cover all the bases and make sure that there's nothing there, which, as Margaret said, the FSA in the UK have set a limit of 17 milligrams per day, but they just want to ensure that over time, if we took 17 milligrams a day every day, then nothing bad's going to happen to us.
And just a quick, and either one of you can answer this question. When it comes to a limit a day, so is that on the consumer to keep in mind what the limit is per day, or does that go into the labeling and packaging requirements on the products out there? How does that work?
Yeah, so it's a kind of it's a sort of double approach, really. So I guess the labeling is very important. So the labeling is there so the consumer knows exactly that that's the limit, and that's the kind of what's suggested as the maximum. But I guess also the products are designed so that it's kind of hard to exceed that limit.
Okay.
You'd really have to kind of go a long way to take more product than you needed to. So it's kind of like a double approach. And
what is the current limit per day?
So it's 17 milligrams of CBD a day is the limit that they've set in the UK. So we're all kind of conforming to that, and all the products are really in that range. So that if you took, say, 2 or 3 gummies or like half a mil of oil, then you'd be getting around kind of that maximum limit.
And Margaret, when it comes to science, we've talked about science driving the research and development products here at Global Widget. Talk a little bit about the processes like the Novel Foods approval in regards to that.
Yeah, I mean, from Global Widget's perspective, and also other CBD companies, I mean, we want the consumers to feel comfortable with the products on the market. So this is just one of many types of studies that we're doing. As Rafe mentioned, there's still some studies to be done in animals. And of course, we've also participated in clinical trials with humans. And there are other consortiums in the CBD industry that are looking at other studies to look at dosing, for instance, in pets. That's a really important question that's not answered yet. And there's still some questions about, in particular, reproductive toxicity, especially in males, that I think, the FDA is wanting to get some data on. And that's what the agencies have said. I mean, they want to make sure that the product's not going to have any kind of chronic toxicity issues, because most people take CBD on a daily basis. And so if you're going to take it every day, we want to make sure that if you do it for 10 years, that you're not going to have some kind of negative health outcome, 10 years from now. And I mean, those things are reasonable. When you go to the store, whatever product you purchase, aspirin or Tylenol, whatever it is, you want to believe that if you follow the dosing instructions, that it's going to be safe and effective for whatever purpose that you're taking. And our products need to be identical to that. And that's why we work on making sure that we understand how CBD works. And of course, there are other cannabinoids also that are being studied right now. And you see just in general on the research side, there's a variety of different, researchers that are looking at how those work and what they're effective for. And so we'll continue to see this type of research, and we'll continue to be involved in it.
And Greer, we talked about, what goes into this process, the large document, the scientific studies behind it. And you talked a little bit about some of the dates, leading up to the deadline. What goes into this process? What's the time frame of having something like this approved for a company? And are there other countries where this is replicated, or does everybody have their own, whole new process?
So the novel food regulation is a European-wide regulation, but of course everyone knows now that the UK is now outside of Europe, so we're not part of that, although we have adopted the novel food regulation into our own law. But it does mean that the UK has a unique mechanism, and the unique mechanism is that the Food Standards Agency is allowing the submission of incomplete dossiers to be submitted to them right now. And as long as they're being submitted by the end of March this year, and product was already on the market on the 13th of February 2020, then the product can stay on the UK market. That is unique to the UK. That's nothing to do with Europe, but it's a way of getting the industry to be compliant with the regulation to ensure safety. In terms of timelines with the actual application process, it's very similar in the UK and in Europe. So you make your submission. There's a short period of about 8 days for an administration check. And then this is where there's a slight variance, I believe, in that the validation phase, so checking that all the data is there or should be there or as agreed. In the UK, they say that's 30 working days. In Europe, they say it's 1 month. Now that's a subtle difference, because 30 working days actually means, a longer time than just 1 month. You
get weekends off.
Yeah, apparently. Well, I'm not sure that Rafe and I do, but the FSA does. So let's say a month for the validation. And then there's the safety assessment phase, where the safety committee, this is the UK, the safety committee will have a look at all the data. Right now, of course, that data is incomplete. Margaret has said there's still data coming in from tox studies, so we're waiting on that. So the committee in the UK, they're going to assess all that data up to the point where they're going to have to wait for the remaining data, and then they're going to press the pause button and there'll be a stop clock. But if there wasn't a stop clock, that whole process is about 9 months, and that's in Europe and in the UK. And that's 9 months without any questions. They accept all the data, they think it's great, etc. And then certainly in Europe, it then has to go around all the member states. So assuming that it's the recommendation is for approval, it then goes around the EU member states to get them to say, yes, we agree that it should be approved, or they may raise more questions themselves. And that's about a seven month process. So really, best case scenario to get full approval, which I've got to say, best case scenario is probably very unlikely, is 18 months from submission to approval. It's likely to be at least 2 years. It could be longer. I'm aware that other novel foods, non-CBD, they're 3 years on and they still haven't got approval. So that's the kind of timeline you're looking at.
Yeah, and final question for both Greer and Dr. Bundy. Does CBD present unique and different challenges from other novel foods from what you've seen so far? I mean, you've talked about some products may already be on shelves, over there anyhow. So what kind of challenges does the industry maybe have that's different from other novel foods?
I'm going to let Rafe jump in here.
I think as Greer said, I mean, first of all, this kind of regulation is being applied retrospectively, and it's kind of like a best fit, So So obviously it doesn't fit 100% and products already on the market. So that's why, as Greer said, we've got this kind of unique position of like the FSA is saying, fine, get something in which is complete and we'll let you keep your products on the market while we assess. So that's one thing. I think the other thing is, of course, you're aware that the difference with CBD is you can have different formulations of CBD. CBD as a chemical, okay, then that's CBD, but as an isolate, it's like 99.5% pure. So obviously I've been working with Margaret on the isolate that you guys do. But if you've got a distillate, that might be 90% pure, or you might have an 85%. You might have a broad spectrum, you might have a full spectrum. You might have different minors. So although that's classed as CBD, when it's going to be assessed, at the end, there won't be like one CBD and one specification. There's probably going to be like 10 or 15 different CBDs from different primary producers with different specifications. So this then gets a little bit complicated because of like, you know, which final products have been linked to which primary ingredient. Eventually, I think the idea is that once they're all assessed, then of course, a secondary manufacturer, so a brand manager can go and say, well, I want that one. That one's been authorized. We'll put that one in my product and we'll sell it. But obviously at this point, that's quite confusing. If it was just one chemical, it would probably be easy because it would be authorized and that would be it. But when you're looking at having extra minors in there, like a little bit of CBDA or CBDV, obviously that might change the safety profile. So that has to be assessed separately to the pure isolate, and hence the complexity.
Lot of great information, Greer and Dr. Bundy. I want to thank you guys both, even with the time difference. I know five hours ahead of us from the time of recording. So I appreciate you guys taking time out of your busy days to join us for this episode of the CBD University podcast. Our first guest ever from the UK, and we're now 67 or 68 episodes into the podcast. So really enjoy the conversation. I'd love to have you guys back again as we go through this process to learn more.
Thanks, Joe. It's been great. Thank you.
And once along this process, and then once the dossier is approved, we'll obviously share that news across our social media networks and our websites. And Margaret, as always, thank you for joining me. And I'm sure we will be getting together very soon for another episode of the CBD University podcast.
Looking forward to it.
And don't forget, for the latest industry news and trends, product releases, everything CBD health and wellness, subscribe to our CBD University podcast. Wherever you get your podcast, you'll get notifications each week when new episodes are published. And as I mentioned in the onset, don't forget full video episodes of our podcast available on the Global Widget YouTube channel and the YouTube channels of our brands Hemp Bombs and Nature's Script. I'm Joe Augustinelli, host of the CBD University podcast. Thanks for tuning in. These statements have not been evaluated by the Food and Drug Administration. CBD products are not intended to treat, cure, or prevent any disease or condition. Always consult your personal physician about CBD and using CBD products. CBD should never be used by anyone under the age of 18. This podcast is not intended to provide legal advice regarding the legal status of CBD and CBD products.